Hello all and welcome back to my podcast show, Dr. Ameet Oswal Cardiac Show. Today we are going to talk about one of the most common topic, which is tests to save you from the heart attack. So let's start. Healthy heart beats more than 10,000 times per day, making it one of the human body's hardest working muscle. It is essential to take preventive care for the heart to reduce the risk of developing cardiovascular disease. Many people are at risk of heart disease but are unaware of it. Fortunately, there are simple tests that can identify individuals at risk of heart diseases, allowing them to take the preventive measures to lower their risk and receive immediate medical care. Individuals more prone to heart attacks and strokes are those who have excessive consumption of alcohol, smoking, high cholesterol levels, or a family history of the condition. To accurately detect the symptoms of the heart attack, cardiologists use advanced imaging techniques and the blood test to derive at a diagnosis for the heart attack. If you feel any of the symptoms like chest pain, shortness of breath, or lightheadedness, doctor might recommend one or more of these tests to diagnose heart attack. ECG. ECG is the first test to perform to diagnose a heart attack or a irregular heartbeats. It is a quick and painless procedure that records the electrical signals in the heart. Sticky notes and wire leads are applied over the chest and over the arms and legs, and then fixed to a ECG machine to record the electrical impulses on the paper. And thus with this, heart attack or the irregular heartbeats, which we call as arrhythmias, can be detected. The second test is Echocardiogram, which helps to detect the most of the structural abnormalities in the heart, starting from the chamber enlargement, valve diseases, previous heart attack related damage, pulmonary hypertension, cardiomyopathies, and among the other rare diseases. It's an easy test done in an OPD basis and using an ultrasound machine with a special echocardiography probe. Third test is the exercise stress test. It's an ECG examination done during a stress test. Basically, we make you walk on a treadmill and slowly increase the speed, and at the same time check the ECG for the electrical activity of the heart, and through this we can detect if you are prone to develop coronary artery disease or you have any major blocks. Other form of stress test we do for those who cannot walk on a treadmill or have severe joint issues. These tests are stress echocardiogram, stress thallium, and stress MRI. The next test is CT angiogram. CT coronary angiogram is becoming famous nowadays since a lot of youngsters are coming with a heart attack. Now the general population is getting aware that there is something called CT coronary angiogram through which coronary artery disease, that is blockage in the arteries of the heart, can be detected. And this is done on a OPD basis in a laboratory where they use a CT imaging, computed tomography, along with a contrast dye which will be injected through your cannula of hand. The other conditions that can be detected by the CT is the congenital abnormalities and heart problems or the aneurysms of the aorta. The next test is coronary angiogram or cardiac catheterization. This test is an invasive test performed after hospitalizing the patient, and it's a minimally invasive test where you have to get admitted for a daycare procedure, and the test hardly lasts for 5 to 10 minutes. In this test, we put a cannula in the artery of the hand or the artery of the leg, and through which we pass another hollow tube which is called as catheter, and then we use a dye under the X-ray machine and detect the coronary artery disease. And the last test is a MRI scan, and this MRI scan again is a routinely done non-invasive test, but the reason for doing MRI scan is either to find if there is a damage to the heart muscle or there are other birth defects or weaknesses in the heart muscle. So that's all for the day. Hope you have got an insight as how important is the cardiac test for your good health. Keep loving your dear one, and also don't forget to love your heart. Until then, it's me, Dr. Ameet Oswal, signing off. Thank you.